How psychologists identify mental instability just by observing behavior. Psychologists don't magically know someone is mentally unstable. What they do is notice patterns of behavior that most people overlook, then interpret those patterns using psychological frameworks, training, and experience. Crucially, they do not diagnose from a glance. They form hypotheses, not conclusions. Here's how it works in detail. 1. Psychologists watch patterns, not isolated actions. Most people notice what someone does. Psychologists focus on how consistently, in what context, and with what emotional tone the behavior appears. Example: anyone can be angry once. A psychologist notices repeated emotional volatility across different situations, especially when the reaction is disproportionate. It's the pattern plus intensity plus persistence that matters. 2. Emotional responses that don't match the situation. Psychologists are trained to notice emotional incongruence when emotions don't fit the environment. Subtle signs include laughing during serious or sad moments, flat or numb reactions to emotionally charged events, sudden mood shifts without clear triggers, overreaction to neutral comments. Most people dismiss this as personality. Psychologists ask, why doesn't the emotional response align with reality? 3. Micro behaviors most people ignore. These are small behaviors that, on their own, mean nothing, but together form a signal. Repetitive self-touching under no apparent stress. Odd pacing, freezing, or delayed responses in conversation. Inconsistent eye contact. Speech that subtly drifts off topic or becomes tangential. Psychologists don't jump to conclusions, but they note clusters of these signs. 4. Speech patterns reveal cognitive stability. Psychologists listen how someone speaks, not just what they say. They watch for disorganized thinking, sudden topic changes without awareness, overly literal interpretations of figurative language, paranoid undertones, rigid, black and white thinking with no flexibility. To others, this can sound like just opinions. To a psychologist, it can signal distorted cognitive processing. 5. Relationship behavior is a huge indicator. Psychologists closely observe how a person relates to others. Extreme dependency or fear of abandonment. Sudden idealization, then devaluation of people. Difficulty respecting boundaries. Chronic conflict across many relationships. Inability to take responsibility for personal actions. Most people see drama. Psychologists see attachment disturbances or personality structure issues. 6. Reality testing, the key skills psychologists assess. One of the most important things psychologists look for is reality testing, the ability to distinguish internal thoughts from external reality. Subtle warning signs, strong beliefs unsupported by evidence. Interpreting coincidences as meaningful signs. Feeling personally targeted by random events. Inability to consider alternative explanations. Psychologists don't argue with these beliefs. They observe how fixed and emotionally charged they are. 7. Regulation under stress. Psychologists pay close attention to what happens when the person is mildly stressed, not during calm moments. They watch for rapid emotional collapse, aggression or withdrawal disproportionate to the stressor, loss of impulse control, sudden changes in self-presentation. Many people seem fine until stress exposes fragile coping systems. 8. Why others don't notice. Most people focus on content, not process. Excuse behavior as personality. Lack a mental framework to connect signs. Avoid uncomfortable interpretations. See individuals in limited contexts. Psychologists are trained to observe across contexts. Compare behavior against developmental norms. Separate empathy from clinical assessment. Hold multiple hypotheses without judgment. 9. Ethical reality. A psychologist cannot and should not diagnose someone just by watching them. Ethical practice requires clinical interviews, history, context, consent, formal assessment. What psychologists do in public is quietly notice risk indicators, not label people. Final truth. Psychologists don't see mental instability. They see fractures in emotional regulation, cognition, perception, and relationships that suggest internal distress or dysfunction. And even then, they stay humble because behavior is a signal, not a verdict.